Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini. Hello, everyone.
So today we're going to test your patience. No, we're not. But we are going to talk about something specific. Doc, what is it?
I'm still on test your patience. I like that.
Why do I do that to you often? Is that what you're trying to say? Oh, that's a whole nother podcast. Here we go. Let's dig
that's
in.
a podcast by itself.
Bring out the dirty laundry, buddy. What do you want to know?
The true story
Yeah.
behind Paul Andrews.
Yeah, right.
Yes. Yeah. Now we're talking about when you should refer a patient out. We get, it's interesting. We get this question a lot, like, "Oh, I have this patient. What do you think I should do?" kind of thing. And a lot of times they'll actually be on the fence about whether or not they should refer.
Well, let me ask you. I'm not the doctor here. You are. I don't understand what the hesitation is to refer out.
Oh, bingo. You win. Do you know this? I think it comes down to an old school thinking that once I send the patient out, they're out of my office and gone forever. And remember a while back we had Dr. Bill Owens on, and he
Yeah.
really drove home the point that we should be working in a collaborative type of environment, not an island like we used to in the old days. So if you really think you're sending somebody out and you're going to lose them as a patient, then that generally means you have no working relationship with the person you're sending them to, which might be something you want to address. Or you don't have any connection to facilities that might provide services that you don't need to send them to another doctor for, like an MRI or, maybe some type of electrodiagnostics or whatever. So the point is that these are services that are within the scope of our practice that we should feel comfortable referring to so that we may decide to treat or not treat. But you're not
Okay.
giving up on the patient.
All right. I have a few things to break down here, but my first question is, or I wonder about is, do you think that the chiropractor is going to say, well, I refer out, and then the first thing they're going to say on the other end is, stop going to your chiropractor?
Well, exactly. So it comes out to be a couple things. One of them is make sure you educate your patient about why they're there and what you can do and what no one else can do for them other than you. The other thing is what I said just a little bit ago was you need to try and nurture a relationship with some of these practitioners. And I'm not saying all of them, but what do you need? You need an orthopedist who won't steal your patient. You need a neurologist who won't steal your patient. You need to have some type of working relationship with some of the PCPs if possible. But for the most part, you need an imaging center where you can send them for MRIs and x-rays if you don't have x-ray in your office. There's not a lot of specialties that we actually need. Be nice if you had a rheumatologist that you could work with because they never cure anything for anybody ever, right? I mean, if there's any specialty out there that has no chance of curing their people, it's usually a rheumatologist. So these are people that you might, if you can look around with, and
maybe a mental health provider to refer out to once in a while.
yeah, that's usually what happens before the rheumatologist, right?
Yeah.
Maybe after the rheumatologist.
Yeah, I'm saying some of
crazy,
your patients
yeah.
you might want to think about.
Yeah. But the point is that you don't need everyone on your side. You just need a few. So, and if they happen to be people that the patient uses that are not necessarily pro chiropractic, again, that comes from a strong relationship with your patient. And maybe you make the connection to the office, or maybe you tell your patient, look, they're going to say, don't come back. I'm saying you should come back. I can help you. It's just we need to make sure it's not this. Once we're sure it's not that, then I can do what I do and I will get you well, most likely. Or if it's something that I can still co-treat with, where I'm going to affect a better change than anybody else, but hey, maybe you might need some pain management through the process if your thresholds are lower. So things like that. It comes out to be moving into that 21st century mindset that we are not an island. If you think we're an island, there's trouble.
Well, and in thinking about what you just said, how you as a provider react to another professional, a peer, as it were, either denigrating you or your profession or just not understanding or believing in it, how you react to that is important, right? So
Hmm.
if you get this response typically through your patient, not even through you, or maybe through the note that comes back to you from that office visit that, chiropractic it shouldn't be continued. If you react in a very strong negative or emotional way to defend it rather than educate, I think that that's a missed opportunity. And I think Dr. Owens sort of talked about that on our episode
Mhm.
because if somebody doesn't understand chiropractic or they just believe the social media posts when somebody either quote unquote got injured by a chiropractor or they watch the ridiculous adjustments by some of these chiropractors that look like they hurt people.
Use kitchen towels. Yeah.
Yeah, like, but if you react in a way that's, "Hey, let me educate. I read your note. I understand you have an opinion, but let me tell you what I do."
Right.
You know?
I always try to take the high road for a number of reasons. One is it's their doctor. Chances are they love them. So the last thing you want to do is put yourself between them, between the patient and the person they already love. They haven't learned to love you yet. You might be a new patient. So don't try and put yourself between a patient and their primary care. It just virtually never works, or a patient and their specialist. Because that that's the case when they come in and they talk about my whatever, my high blood pressure, my diabetes. It's telling you right then and there they take an ownership of that disease or problem and that the person that is saving them is their primary care. So, number one, take the high road. You don't put the person down. You just say, well, I would be happy to have a conversation with your doctor. Like you said, I'd be happy to explain what it is that I think I can or what I may or may not be able to do. You can tell them that. I'll reach out to them if you want. I'm sending the report. Remember, we talked earlier. The best thing you can do is send the initial patient's report. You just try and act cooperative and let the patient know that if this gets shut down, it's not because of lack of trying on my end. And then what happens is you sort of knock that that godlike figure down a few notches because they won't
Maybe.
maybe they won't spend the time, effort, or energy to do what you're willing to do, and that's have a conversation about me, the patient. Guess what?
Yeah.
I don't care about your politics. This is all about me, especially if they've already improved a certain degree before you make this referral.
Perfect. I mean, as you say, if they disparage or at least just turn off the patient to chiropractic, it, to me, that's a conversation
Closed-minded.
opportunity.
Yeah.
Like
Yeah. Just say, "Oh, I'm not closed-minded. I
fire back about
obviously, I
that.
believe in medicine. I sent you
Yeah,
to them."
yeah,
You know?
yeah,
So
yeah. It's more like having and trying to create a dialogue, whether it's in person on the phone or through a written report back with that
right.
provider office or that provider.
You
Right.
you don't need them to love you, you just need them to get out of the way.
Well, yeah. But, sometimes I've experienced this, especially with physical therapy, where it's a lack of understanding from a reimbursement side. I've seen physical therapists say to the patient, well, if you see me, you can't see your chiropractor. And
Right.
it's because of payment. But really what it is they're under this presumption I can't see the chiropractor the same day as the PT or concurrently care. Not understanding that number 1, you can. Number 2, if you're delivering the same service on the same day, that's when you get into trouble. So some chiropractors don't understand. I'm gonna
Mm.
refer you out to PT. So then the PT gets them, then the chiropractor continues to still do things like electric stim and therapeutic exercise. You just refer them out for this kind of stuff. Like,
Right.
stick to the
And
adjustment until
when would you? Yeah, when would you refer? What are some of the reasons to refer?
right.
It's,
Well,
what are
sometimes
it's
it's coverage, I'll be honest. It's like
yeah,
they only have spinal manipulation only coverage in their office, but they need supportive procedures. Fine, refer
exactly.
them out.
Exactly. Oh, what if you're not really sure? So a patient comes in, they show all the signs of a space occupying lesion They have sciatica, they have numbness, they have tingling, weakness, or whatever going down their legs, follows a certain nerve path, whatever. So your exam tells you you're pretty much convinced it's a disc of some type. But it's really not. Those procedures really don't tell you it's a disc. It tells you it's a space-occupying lesion, and you don't know which one. So you might still be able to treat this patient while concurrently ordering an MRI to confirm, which is all medicine does, right? Tests just confirm what you suspect. There's nothing wrong with that. The problem comes from when you're unwilling to do stuff like that, thinking you're supposed to know it all. We don't know it all. Nobody knows it all. So if you have a diagnosis
Well, I'm
that's
gonna
uncertain,
isolate that sound bite
yeah,
right there.
no. Oh my God. Yeah. So if you have a diagnosis you're not sure of course you would want to send the patient out to try and confirm the diagnosis, right? It's that simple. Or, another one, what if they're not getting better? Well, what does that mean? Well, they're not getting better after my 78th visit. I think maybe you pushed that one a little too far. Okay. Maybe
Like,
just a smidgen.
the magic one could be the 79th, you never know.
There you go, right? But the acute criteria is the same as it's always been, but they've recently reiterated it, maybe about 4 years ago. Generally speaking, 2 weeks worth of care. You should notice a significant improvement. That doesn't mean they're better. A significant noted improvement in either subjective and or objective findings. If not, change your approach. If they still don't respond in another 2 weeks, you can refer out for more testing or second opinion or concurrent treatment. Something we as
Yeah,
as
but
a profession haven't learned yet.
what if what if there's an ego involved here though, right? Like,
What if?
why are you looking at me like that? How dare
I'm
you?
staring right at
How
you.
dare you? But, like, the doctor's like, "I know this person should be getting better. I know I can get them better."
Right. Well, number one, if you ever went to chiropractic school, we never get anybody better. We
Well,
know that's the
I
power
hope
that
if you're calling yourself a chiropractor, you went to school.
exactly. It's the power that made the body heals the body, period, end of discussion. Okay? We don't make anybody better. We give it an opportunity for the body to do its thing. So if you ever have said that to yourself or otherwise, then please stop. The idea here is to recognize that it's all about the patient, not about you, not about the MD, and not even about the patient's opinion so much as making them well. So always focus on the patient's needs, and you generally will never make the wrong decision.
Yeah, that's the whole, like, I always talk about treat the patient, not the claim, right? That
Mhm.
whole situation there, you know? But, is there any potential liability when a chiropractor refers out and an incident may happen with the doctor they referred out to?
Well, generally, when there are malpractice claims, obviously, you can be sued if you injured somebody and that injury resulted in some permanent damage. So there's usually lawsuits from that. But there actually can be lawsuits that come from, and are very common, but come from failure to diagnose. And that failure to diagnose either delayed proper care or resulted in some type of permanent residual damage that ended up having some level of disability attached to it. So you are required to find out what is wrong with the patient. It's not a guess. You shouldn't be guessing at it. So if the patient is responding according to the standard of care, great. If they're not, you are obligated to find out what's wrong with that patient, which means if it requires you to call their primary care, then that's what's required of you. It's not an option. You can be sued just for simply missing it, and that happens a lot, because you don't wanna bother with the MRI or, "Oh, his primary care is a real ass," whatever you wanna talk. I don't care. The obligation comes out to be the patient, number 1, but number 2, y protecting yourself.
So what I'm hearing sort of in a way is that you're obligated to know when something isn't correct or normal. And if it's outside your expertise, it's really your obligation to push them to someone that will find out what's going on.
Absolutely. I mean, when I was getting my diplomat in neurology with Dr. Ted Carrick, who's a phenomenal human being, interesting human being for sure. But he used to drive into us that we don't need to know abnormal. We only need to know normal. And he was mostly talking about exam
Was he
procedures
staring
and
right
things
at you
like
when he
that.
said that?
He never looked at me and used the word normal in the same sentence.
Yes.
Okay. Oh, and he was mostly talking about exam procedures, but it also
Sure.
applies to
Sure he was.
response. Yeah. All right.
Yeah.
Such abuse.
I know.
Um, but he was really also talking about response, that you would expect a certain response. And I think what chiropractors fail to do way too often is recognize it ain't working, people. Try something different, do something else, send them somewhere else, but it ain't working.
Do you think well, when you went through school back in, like, the 1700s, did they teach this?
Wait a minute, my
Wait,
memory's fading.
chiropractic
I'm
wasn't
trying
even
to.
invented back then, right?
Yeah, yeah. My memory's a little weak. Let
Yeah,
me recall it. Yeah,
yeah,
they did. This is what I mean. It's so great. We tease a lot about my age and everything, but
yeah.
it's really great as a guideline, because if I graduated in 1981 and I can say readily that I was taught what I'm talking about and clearly educated in what I'm saying, which is 99.9% of the time, then that means everybody after me has to know it too. It's not
But
like
do
you
they
weren't
teach it
exposed to this stuff.
do they teach that now? Do we know?
Well, I've talked to a lot of younger doctors and everything. I believe they actually have even gotten better at it. I'll say that. I mean,
Wow. Hey,
I
schools usually get a bad rap, but okay.
I know. But as far as diagnostically speaking, I believe the schools do a better job today than when I was in school. And if I was taught it when I was in school, yes, it was more said in class, mentioned it, might even got a test question on it, and then maybe never really pushed hard after that. So I happen to remember it. But what I'm saying is it was there. Where today, I do think the education drives it home a little bit stronger than when I was in school.
Just as an aside, do you think that the radically new and, technology in education, do you think it gets in the way sometimes?
Oh, well, now you know, yeah, absolutely. I mean, I will definitely step into my older category here and say for
Oh, here
sure
we go,
they
everybody.
get
Stand back.
they get wrapped up, and yeah, you get wrapped up in the bells and whistles. It's like buying a car because it has a nice computer, when really you're buying a car so you can get from point A to point B. Not because it has a nice computer in it. It was funny. We were talking. I was talking to a neighbor, and he just bought a brand new, beautiful Denali truck. Okay,
Yeah.
beautiful, loaded, things size of a house, right? And his wife drives a BMW SUV, the larger one. And the little 10-year-old is standing there, and I said, "Oh, do you like your daddy's new truck?" And she said, "Yeah, it's okay." I said, "Well," I go, "Well, what don't you like about it?" She goes, "Doesn't have Wi-Fi."
Oh my gosh.
Where the BMW has Wi-Fi, she says, I can use my iPad in mom's car."
Oh,
And
okay.
too many people look at that as the reason you have a car,
Okay,
is that it has
as an
Wi-Fi.
aside,
Yeah.
daddy probably made sure there was no Wi-Fi for a reason in the truck, right?
Here's the irony. I was actually installing Wi-Fi in my truck at the
Oh,
time.
that's funny. Daddy be like,
But I'm
"Sorry, there's
just
no Wi-Fi, honey. I guess you're gonna
yeah,
go with mommy."
yeah. So, well, I'm just putting it in my older truck, you know?
Yeah, that's
But,
funny.
that's what I'm saying, though. Some people focus on the wrong thing. And to answer your question about the technology, yeah, I do think sometimes you get overly excited about the chrome and forget about the wheels.
Well, I mean, that's how it is today, do you know what I mean?
I
But
know.
anyway, getting back to when to refer out. I digressed, all of
Mm,
us. So sorry,
yeah,
everyone. Just,
yeah.
kinda interesting, but, when I look at it and I look at, you know, from the claims perspective, I really don't see a lot of referring out at all. And I
Mm,
wonder, in the olden days, right? you used to see the chiropractor at the end of your rope of treatment, but now you don't. You see it sometimes at the very beginning or somewhere in
Yeah,
the
you may
middle
be
of it.
first. Yeah.
Right. So, do you think there's like this institutional sort of passing down of, chiropractors are typically or have been rogue and, isolated in the world of medicine?
Well, exactly what I say, we're not an island anymore. I
Yeah.
did practice on an island in the early years because nobody would even think of endorsing you
Was it
outside of
hey,
another
man, was it island
chiropractor.
time and
Yeah,
everything too over there?
yeah, no, don't put
Yeah.
yeah. No, it was,
Bucket of cold
it was
beers in
an
the
island.
clinic, you know?
Yeah, there you go. Yeah, steel drums, the whole
Yeah,
bit, yeah.
yeah.
Yeah, the whole bit, well, I used to always say that my office, was a nice poster of a beach and called it the last resort, right?
Yeah.
So, same idea, right? But, yeah, it was more of an island then, where now, because we are seeing people earlier, we're gonna get more complex cases, more complicated cases, which means that we may have to co-treat or refer out more often than when I would co-treat or refer out, for sure.
Do you think once they get into the medical system, like, you refer them out and that particular provider, this isn't a problem for me. Do they send them back to the chiropractor for more, or do they get into the medical system where then they end up dominoing down the medical world?
Well, again, it comes back to your relationship with them, and I've told this story before, but my primary care used to send me a couple patients a week. And when I asked him if he wanted to come into the office and see what I did, his answer was, "No, I don't care. All I know is they come in here, they have this problem. If it's something I think you can help them, I send them to you. They come back and tell me they love you and they feel good." But conversely, the positive side of that is if they come in and they have a medical condition, I know I can tell them to go back to this person. That person will treat their medical condition and not discourage them from coming back to me. So it does
Hmm.
work both ways. I have the comfort of knowing that I can send them out for something that's beyond my scope and not lose the patient. And he looked at it the same way. I can send this patient with low back pain that I don't want to deal with to Davini and know that Davini is going to keep them, sending them back to me because they're my patient. So if you think of it from the source, whose patient was it first? If it was your patient and you referred them out to the specialist, then you should be the lead. They should be communicating with you. If it's their patient and they come to you because of a failure of that person, then maybe take the responsibility of communicating to them. Have a little respect for who owns the patient first, in a sense. Like a
I'm not
better way
sure
of
they
saying it.
will, but do
No.
do
Push.
chiropractors ever get asked does their patients ever ask them for a second chiropractic opinion? Like, is that a thing?
It's not so much a thing, but maybe it could be a thing more often, to be truthful, um, because techniques vary, people vary. There are things that other chiropractors did that I didn't do. Following the 80, 10, and 10 rule, 80% get
Yeah.
better, 10% improve, 10% don't. We know that 10% that don't respond to my technique are not the same 10% that might respond to someone else. And we should. We should do that more often. We don't, unfortunately. Sometimes it takes a patient's direct request. I am looking for someone who does kinesiology, like I've mentioned before. And I didn't do kinesiology, so I had friends of mine that were great kinesiologists, and I'd
Yeah.
send them to them. So it should be
I know we're gonna
more respect that way.
I know we're gonna get emails about this, so I probably shouldn't say it, but
Go ahead.
especially the much more philosophically minded chiropractors. But do you think that there isn't there isn't a lot of requests for second opinions in your chiropractic because the stakes aren't as high? I mean, I know I'm going to get in trouble for that, but you know, it's not like cancer diagnosis or
Right, right.
something that where the stakes are much higher in a sense.
And it's a great way of putting the or posing the question because it's kind of a pet peeve of mine that the chiropractic adjustment when you're talking to chiropractors seems to be the be all end all when it benefits them. But all of a sudden they're in a risk management situation, a lawsuit or whatever, and they start saying things like, "Well, I only adjusted the patient." So get on board with what you believe. If you believe it's only an adjustment, then it will never be more than that. If you believe it has the power to do what we know adjustments can do, then you respect it more and it will be presented that way when you talk with others.
Please direct all of your comments to Dr. Davini to
Blah,
podcast
blah,
at
blah, 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 blah,
allthingschiropractic.com.
blah, blah. Okay.
Hey, we're not here to make friends. We're here to just talk about the real items, the
Hey,
real topics, right?
that's right.
Give me a
Yeah,
break.
it's real talk. It's
Yeah,
it's all things
exactly.
chiropractic, real
Yeah.
talk.
Reality check.
Yeah. Yeah.
Oops.
Right. Oops.
All right, maybe we should bail out of this episode before we get
I
in more
think so.
trouble.
Before we start going further, yeah.
Well, I think you've said it all, Doc.
Try.
Yeah.
Usually try.
Yeah. All right. So, again, a nice companion episode to this is the Dr. Bill Owens episode that
For
we had
sure.
him on for sure. So, well, thanks again for listening to another episode of All Things Chiropractic. Hopefully you're back again at some point. I'm Paul Andrews.
Dr. Mark Davini, come on back.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.